How does bile color affect liver health? Imagine your body as a busy factory, with the liver acting as the main processing plant. One of its key jobs is producing bile, a fluid that helps digest fats and get rid of waste. Bile is made in the liver and stored in the gallbladder, then released into the small intestine when needed. The color of bile is usually a bright yellow-green, thanks to a pigment called bilirubin, which is a byproduct of breaking down old red blood cells. When everything is working well, bile flows smoothly through the bile ducts into the intestine. This flow gives your stool its characteristic brown color because bilirubin is processed and excreted. But if there's a problem with the liver or bile ducts, the color of bile can change, and that can tell us a lot about your liver health. If bile flow is blocked or reduced, bilirubin can't reach the intestines properly. This causes stool to become pale, clay-colored, or even putty-like. Pale stools are a common sign that something is wrong with the bile ducts or liver, such as a blockage from gallstones, tumors, or inflammation. Conditions like liver infections, biliary cirrhosis, or strictures can also cause these changes. When bile isn't reaching the intestines, it can lead to malabsorption of fats and fat-soluble vitamins like D, E, and K, which are vital for overall health. In addition to pale stools, problems with bile flow often cause jaundice, which is a yellowing of the skin and eyes. This happens because bilirubin builds up in the bloodstream when it can't be excreted properly. You might also notice dark urine, since excess bilirubin is filtered out by the kidneys. These symptoms are signs that the liver is struggling to process waste and may be at risk of more serious damage. Cholestasis is a condition where bile flow is impaired, and it's closely linked to changes in bile color. It can cause symptoms like jaundice, dark urine, light-colored stools, and itching. Because bile is essential for digesting fats, cholestasis can lead to fatty stools and deficiencies in fat-soluble vitamins. Over time, ongoing bile buildup can cause inflammation, scarring, and even damage to the liver tissue itself, which may progress to cirrhosis or liver failure. From a liver health perspective, persistent changes in bile color, especially pale stools and jaundice, are warning signs that your liver or bile ducts may be compromised. These signs often appear before more serious conditions like liver cancer develop. Monitoring these symptoms and seeking medical advice early can help catch liver problems in their initial stages, improving the chances of effective treatment. In summary, the color of bile is more than just a visual detail. It's a vital clue to how well your liver is functioning. Pale or clay-colored stools and yellowing skin or eyes indicate that bile isn't flowing properly, which can be a sign of underlying liver or biliary disease. These changes highlight the importance of regular checkups and prompt medical attention to maintain liver health and prevent serious complications. If you notice any of these signs, it's always best to consult a healthcare professional for a thorough evaluation and personalized care.